Want to talk about IVF medications. So remember we talked about in an IVF cycle, patient gets their menstrual cycle. Again, we call that cycle day 1. And now the patient starts their IVF medications typically around cycle day 3 through 10, 11, 12. Again, that can vary based on the patient and the clinic's protocols. But when we talk about IVF medications, again, there are a few different medications to stimulate the ovaries. So one is called Follistim. Another one is called Gonal-F. And then a third one is called Menopur. So you'll see different types of protocols using these three medications. These medications contain a hormone, follicle stimulating hormone. Therefore, it does just what it stands for. It stimulates the follicles and the eggs to grow and develop. And so when they do that, you're typically on these medications for about 10 days. And during that time, the patient's coming in and out of the office every other day, maybe sometimes daily, to see how they're responding. Now remember, these medications we label as gonadotropins or follicle stimulating hormone. But what typically happens as the patient's ovaries are being stimulated and eggs are growing and developing, the patient is at risk for ovulating or releasing their eggs too early, meaning they can ovulate their eggs before you get to the egg retrieval because the body is naturally meant to do that. So there are medications that we use that will prevent someone from ovulating or releasing their eggs. So what are those medications? There are a couple of different classes of medications. One is called ganirelix. Another one is called cetrotide. And these medications are typically called antagonist. And they are antagonistic to letting you ovulate. And so these medications are typically started somewhere around day 8, although plus or minus. You can get these medications started so that you can actually then slow down or prevent a patient from ovulating after these medications are initiated. And that way the eggs are still in the ovaries when you get to the egg retrieval. Now, there are other ways to suppress ovulation. There is another medication called Lupron, and we talk about Lupron in different areas of an IVF cycle, so it's very important to understand its role. So there is one way where you can actually start Lupron before the IVF cycle and continue all the way through. There's another way where you can actually start it with the menstrual cycle. And Lupron is actually an agonist, so not an antagonist, but an agonist. But it also works to suppress ovulation in a patient's IVF cycle. But we also have Lupron when we talk about trigger shots. So that's where it can get confusing on which way it is. And it's very important to understand that. We'll talk about that maybe in another video about when to know what the clinic is using Lupron for. But nonetheless, okay, so the patient is being stimulated, again, with follicle stimulating hormone or one of the other medications. There is an antagonist, ganirelix or cetrotide, that gets added into the cycle a little bit later. And then when the patient is ready to give the trigger shot, you have a couple of options. So when we talk about trigger shots, you can give an HCG injection, typically Pregnil or Novaril are the meds for that. You can give a Avidril injection, which is a different kind of HCG injection, or you can do a Lupron trigger. So there are a few different ways to do the trigger shot. And when you give the trigger shot, that helps then to actually start getting the patient's eggs mature, and it changes things a little bit physiologically. I don't want to get too far into the weeds in that, but you start to change the eggs from where they were to getting ready to do the egg retrieval. Again, typically the egg retrieval is done 36 hours later, but these are probably some of the most common medications used during an IVF cycle, and at a high level, what they actually do to help get the eggs ready for the retrieval.